When patients come to me with a kidney stone, they tell me it is the worst pain of their life, worse than even having kids. The two most important things they want to know is, number one, will they pass the stone or will they need surgery? And number two, how long will it take? Hi, I'm Dr. Chan. In this video, I'm going to share with you the answer to these two questions. We'll look at this American Journal of Radiology article that studied this question by looking at CT scans from patients with kidney stones, looking at the size of the stone and the location of the stone in the ureter. And they calculated how likely it would be that that stone would actually pass. There were 172 patients with kidney stones in their study. 115 passed them spontaneously, and unfortunately 57 of them needed to have surgery. So first, let's talk about size. Something 4 millimeters or smaller has a pretty good chance of passing, an almost 78% chance in their study. Now this is something that's 4 millimeters, just to give you an estimate of the size. Stones 5 to 7 millimeters have a lower chance of passing, but they can still pass, close to around 60%. And then finally, 8 millimeter to 10 millimeter stones have an even lower chance of passing, 39%. And in this study, stones bigger than 10 millimeters, none of them passed. This table here goes in a little bit more detail. You can kind of look at the numbers. And it might seem kind of weird that a bigger stone might have a higher passage rate than a smaller stone. But once again, the sample size of these isn't huge. And so that's why we aggregate them together into groups, 2 to 4 millimeters or 5 to 7 millimeters, just to get a better idea. Next, let's talk about how the location of your stone on the CT scan impacts whether the stone will actually pass. Usually there's 3 spots that stones get caught up on: the ureteropelvic junction, where it crosses over the iliac vessels, and then finally at the ureterovesical junction, right by the bladder. If it's in the proximal ureter, there's about a 50% chance that it'll pass. Now, in the mid to distal ureter, the chances are a little bit higher, 60% to 75%. And then finally, at the ureterovesical junction, it's close to 78%. This is a good table that summarizes it. Next, let's talk about how long does it normally take for a stone to pass based on the size. In this Journal of Urology article, they looked at 75 patients. 41 had stones 2 millimeters or smaller, and it took them about 8.2 days. 18 had stones between 2 to 4 millimeters, and it took on average about 12.2 days. And then finally, 16 had stones 4 millimeters or greater, and the average of passage of time was 22.1 days. So I hope this gives you kind of a rough estimate of amount of time that you might expect before you pass your stone. So this is one of the reasons why kidney stones are worse than childbirth, because it can sometimes be longer than 22 days for it to pass. Well, thanks so much for watching. If you have any questions, please leave them down in the comment section below. And if you haven't subscribed already, please do. Have a great day. Bye.